Anesthesia Day, and that's why we have Dr. Karisha Hinkson here with us on the show, one of our doctors at the Queen Elizabeth Hospital. Good to have you.
Hi, thank you for having me.
Talk about everything anesthesia this morning. Big celebrations planned, and you're celebrating 170 years of advancing patient safety.
Absolutely.
What does that mean for you as one of the professionals involved in the field?
Oh, thanks for that question. So it's very exciting for us. We've started in this particular profession with very basic things from herbal remedies, and now we are in a fantastic era of science and technology, being able to advance the science so that we're able to offer some amazing things to our patients, from not being put to sleep at all, but still being completely comfortable, pain-free, and having a chat, to everything else that we offer.
I was going to ask, what does anesthesia look like in terms of delivering that patient care in 2025? And you say not always having to put people to sleep, but still not, they're comfortable, and they're not in pain either.
Yep, that's correct. So we're fortunate to be in the age and stage of advancing medications, advancing technologies, that we're able to facilitate many more surgeries with just some parts of the body being completely numbed and unaware of what's going on. The patient can be resting, they're regular sleep, or completely knocked out, as we might say, and still be able to get their procedures done, be comfortable, be safe. So it's a good thing for us to be able to come this far in so much time.
And it's one of those facets of medicine that is really fascinating. It's really interesting. Talk a bit about the study of anesthesia and why it is so important in the medical cycle in making sure that our patients are cared for.
Absolutely. I think one of the major things about anesthesia is that many people do not recognize how far-reaching our specialty goes. And I'm really pleased and excited about this World Anaesthesia Day theme, Anaesthesiology in Health Emergencies, because we're given the opportunity to be able to show our medical colleagues all across the healthcare diaspora that we're able to provide more than just putting the patient to sleep, more than just passing gas. We are able to provide emergency management counseling. We're able to do our perioperative services. We're able to transition from our elective uncomfortable state to a state where if we become resource poor or more resource poor, we're able to action and be able to coordinate emergency efforts while continuing to keep that level of patient safety and patient care. So we will span from the preoperative, where we will see patients, flag anything that might be not quite right with them, see if we can optimize them as best we can, all the way through to critical care if, Lord forbid, they need advanced care, for example, ventilation, support for their heart and other organs. We're able to provide that as well, and everything in between.
Is it a study of medicine where you see a lot of the young interns and doctors getting involved, or is it a subspecialty that after that initial study that they are then involved going forward in their career?
That's a good question. So it does tend to wax and wane according to the groups. Like currently we have quite a few of our 4th and 5th years in medical school, and they're very excited to move on to explore an anesthesia career. But then we do have others that perhaps explored other specialties before, emergency medicine, surgery, and then while they were rotating through anesthesia as part of their programs, they decided to make a switch.
Right.
So it is one of those things that, once you learn more about it, you either find that passion for it, or you decide, okay, I respect you, but I will move on to other things.
So all of the interns have a bit of rotation, a bit of a taste for what anesthesia is all about.
Yes, they do. They do, from medical school stage. So from 4th year in medical school, and then yes, they can get the opportunity, especially a little bit after internships. Once they understand a little bit more about medicine, they can come and rotate through with us again.
Okay, so you have a special meeting today at the main auditorium at the Queen Elizabeth Hospital.
Yes, we do.
What is that about? And is everyone invited, or is it just for the medical fraternity?
All right, good question. So we are having our celebrations in the auditorium, like you said. It will be hybrid, so it's in person. We do expect most of our in-person attendees to be medical professionals, and I mean for the full gamut of the health professionals. So my allied health professionals, I expect to see physiotherapists there, my dental team there, my sports team there, along with, yes, our other medical doctors, our nurses, our anesthetic aides, or orderlies. I want all of our medical fraternity to be there. But I do encourage the public, if they want to join on by Zoom, that they can. Forgive us, most of our talks will be pitched to the healthcare fraternity, but if you're able to follow, I do think it's a good opportunity to learn more about anesthesia and what we do and what we provide for our community.
What are some of the common misconceptions? And we'll share the Zoom link, hopefully, on that Facebook or YouTube feed so that those of you who are interested can get connected. What are some of those common misconceptions with anesthesia and the practice?
All right. So one of the first would be that we're not doctors. So while there is a very rich practice of certified registered nurse anesthetist in the Americas, in the US, and in the UK, we don't have those in Barbados. So people assume that we're the nurse, we come and we give them a medicine and then we leave, which could not be farther from the truth. We are involved from even before you're in the operating theatre, absolutely with you throughout. We are specially trained not only as doctors, but then we go on to be specialists, and some of us subspecialists for a particular area, particular surgeries that are high risk, and then we provide that care to you. We also obviously are under the umbrella of education. So I'm also a lecturer in anesthesia at the University of the West Indies Cave Hill campus. So we do kind of spread both our skills in education. We have a simulation specialist, as well as, multiple subspecialties. So I think I would like my public to know we don't just kind of give you a medicine, walk away and come back. We're there with you the entire time to make sure that you're safe and alive as best we can and as comfortable as possible.
Yeah, and the thing is, once you're dealing with surgery, anesthesiology has to be involved, or some element of it.
That is
some
correct.
element of it.
Yep.
And there are some other specialties that are not.
Yeah.
And then you have the doctors and the team in anesthesiology. And as far as that practice is concerned, it's not only doctors. You have anesthetic aides. Talk about some of the professions associated with anesthesiology and direct some of those young people out there who are possibly thinking of a career, and this could be a career path for them. Direct them about some of those careers and where they can go.
Okay, absolutely. So we have our physician anesthesiologists, which can be our general anesthesiologists or subspecialized. We have our anesthesia aides or technicians, and they will manage all of the equipment that we will use on our patients. So we'll make sure that they are safe, that they're appropriate size, the right type, etc. If there are any things that are not quite matching, they will make sure they're there. We then go on to our anesthesia assistants. We don't have yet in Barbados, but I hope to be coming soon, where they're essentially a physician's assistant, but strictly for anesthesia. We then have our nursing anesthesia. So from the certified registered nurse anesthetist, again, not practicing in Barbados, but in many of our sister Caribbean islands, they do practice. And then we have our nurses associated with perioperative care. So that's another avenue that they could be interested in. So we do have quite a few things that they could come, get a feel for it, have a listen, and see if it's something that you could get more information on.
So what is a day in the life of Dr. Karisha Hinkson like? What does that day, not this morning, not today, the day is a little different for you.
A little bit.
But tell us, what is a day in anesthesia like for you?
Okay, so
deep breath first.
Yeah, it truly depends on the day. It's a very early start. The truth is our day probably starts from the night before. We review our patient notes for the patients that are coming up for the day before, the next day. We get to the operating theatre quite early because we know we have to prepare for not just the first patient coming, but for the entire list. We do a cross-check with all of our team because we are team leaders in our own right. So make sure that we are having a good plan with the surgeon, with our anesthetic aides, with our nurses, to make sure we have a good flow of things and make sure patient safety is the center of everything that we do. And then after we do our list is usually quite high-paced particularly our Thursday list, quite high-paced.
Today's Thursday.
Yeah, my list is usually on Thursdays. And we will often go quite into the night just to make sure that we get all of our patients covered. And then at the end of that, we just make sure that everyone who has surgery today is still doing well, that their pain is optimized, and then go home and probably grade some undergraduate papers for anesthesia before, doing my other job, which would be mothering and just being a partner.
Listen, it isn't, well, that's intense alone, and then you add that long list to it. You're doing some great work. Kudos to you. Hear what is happening at the Queen Elizabeth Hospital in terms of the number of surgeries that are done on a daily basis. Sometimes there is a backlog. Yes. But we try to clear it. The Queen Elizabeth Hospital tries to clear it as best it can. But continue the good work, and happy World Anesthesia Day.
Appreciate it. Thank you very much.
Celebrating under the theme
Anaesthesiology in Health Emergencies.
Anaesthesiology in Health Emergencies. And again, if you want to get connected and find out a bit more about the profession, those of you students watching, before you head out to school this morning, you can connect. We'll try to share that link so that you can connect with that forum. See if it's something that you're interested in. I always say it wasn't for me, but maybe it will be for you. I mean medicine, because you really got to salute those doctors, nurses, and all of those in the medical fraternity. It's a lot of work, a lot of dedicated service, and a lot of hours. Yes. Many hours dedicating yourself to the study of medicine to make sure that we safeguard the lives of those persons who come through the doors of the Queen Elizabeth Hospital and other medical facilities right here in Barbados. Thank you, Dr. Karisha Hinkson. You'll get to see her and hear more from her later today at that forum.
That's correct.
Yes, so you can look out for that. And of course, we'll share the information as it comes to us here.
Morning, morning, morning. Good morning.